Hi there, it's Tracy from Natural Childbirth World, and today I have the privilege of speaking to an amazing person, a world-renowned expert in all things natural birth. Her name is Dr. Sarah Buckley. If you're not familiar with Sarah's work, let me just fill you in a little bit. She's originally from New Zealand, now lives in Brisbane, near Brisbane, in sunny Queensland, Australia. She's written several books, including her bestseller, Gentle Birth, Gentle Mothering. I'll put a picture on the screen there. I was actually lent this when I was pregnant for my first baby almost 5 years ago. It was a great read. Amazing information. She's a GP, family physician, with qualifications in GP obstetrics, and she's also a mother of 4 beautiful children who, surprisingly, you might find that were all born at home. She's been featured in several films, including the latest one, Freedom of Birth, and is being described as a person who marries the medical mind and the birthing woman's body wisdom. She's into ecstatic birth, attachment parenting, co-sleeping, long-term breastfeeding, lotus birth, raising babies without nappies and diapers, yoga in pregnancy, and mothering, and gentle discipline. Plus, she's also launched a new website, which we'll talk about a little later. So, Sarah, thank you so much for joining me today.
Thanks, Tracy. A pleasure to be here. And thank you for the work that you do. I love your ebook. It's a great read.
Oh, thank you so much. I really appreciate that. All right, so look, there's so many things I could ask you because, I could really delve into some things in depth, being a bit of a birth junkie myself, but I really want to, there's a lot of people that follow our website and on our Facebook page, and they are new mothers, or perhaps they've not had their first birth experience hasn't been great. So I kind of want to ask some questions for them. And some of the topics I've sort of picked out today that I want to touch on is what you call ecstatic birth. Then I've got some questions that people have asked on our Facebook page. An interesting one I found, raising babies without nappies. I have to ask you about that. And of course your new website. So first of all, let's start with ecstatic birth. What do you mean by ecstatic birth?
Well, ecstatic birth, if you look at what the word actually means, it means ec means outside and static means place. So it's an experience that takes us outside ourselves. So I use the term in that sense. But I also use it in a physiological sense, you could say, because what I say about ecstatic birth, I say it's Mother Nature's superb design for mothers and babies. It's a blueprint. It's a hormonal blueprint that Mother Nature has for every mammalian mother and baby. And there's a lot of hormones that we release during labour and birth. And when I talk about ecstatic birth, I talk about in particular 4 of the hormones. And if you want to know more about this, I recommend you go to my website, sarahbuckley.com, and download my free ebook called Ecstatic Birth, Nature's Hormonal Blueprint for Labour. So I talk about the hormone oxytocin, hormone of love, the hormone beta-endorphin, which is a hormone of pleasure and transcendence. Talk about adrenaline and noradrenaline, hormones of excitement, and prolactin, which is a hormone of breastfeeding and tender mothering. And we get peak levels of all of those hormones during labour and at that time of birth and for the hour after birth. So we're saturated. We've got these extreme levels of love, of pleasure and transcendence, of excitement and of tenderness and tender mothering. So it's an ecstatic hormonal cocktail, you could say. And it's not just, Mother Nature doesn't design it just as a good feeling. If you've had a really positive experience of birth, you'll know what I'm talking about, all of those amazing euphoria and ecstasy that you feel when you meet your baby. But it's not just about a good feeling, it's actually about survival for mothers and babies. So when the mother gets this big hit of ecstasy, of peak levels of her ecstatic hormones, it actually protects her from bleeding from those high levels of oxytocin. It makes sure that she bonds to her baby. It activates the reward centers in her brain so that she will be, as I say, positively addicted to her baby, because that's about species survival. That feeling you have when you look in your baby's eyes is not just a good feeling. It's really Mother Nature making sure that you're rewarded and motivated enough to do all those things that every mammalian mother does for her baby, which is carry, for us, we need to carry our babies around 24/7. For most of human history, that's been a necessity. And we need to breastfeed. So all of these hormones also optimize breastfeeding. The oxytocin and the beta-endorphin that are released in labour begin to stimulate prolactin release, which starts to switch on the milk production for you and your baby. So ecstatic birth is Mother Nature's superb design, and it really optimizes outcomes for mothers and babies, not just in terms of safety at birth, but also in terms of ease and pleasure, and ongoingly optimizes breastfeeding and mother-baby attachment.
I find it interesting because obviously you have that credibility of being a doctor, and so it sort of sounds like a lot of the stuff where, say I will talk about, I'm not medically trained, or other people who are childbirth educators or midwives sometimes can come across as all this stuff's a bit hippie, but it's not, is it?
No, it's not hippie at all. It's normal. It's what Mother Nature designs. It's our physiology. In fact, the new way we describe it, we say physiologic birth. Childbirth that is follows our physiologic blueprint, the way our body processes are designed to operate. So it's not hippie. It's not out there. I mean, it is different to our normal obstetric system, our normal maternity care system. And I would say from a hormonal perspective, one of the reasons that women have so much difficulty in labour and birth is that their hormonal orchestration doesn't flow. And the main reason that our hormonal orchestration doesn't flow and we get stuck in a hospital in an unfamiliar environment is exactly the same if it was a cat or a dog or a horse. And people that breed animals know that the core requirement for the labouring female is that she feels private and safe and essentially unobserved, but we don't sort of apply that to women. We put them in a situation where they're not private, they're on totally foreign territory, they've got strangers looking after them, and they're intensely observed. And all of these things, any other man would switch labour off, and that's essentially what happens to women in labour. The levels of the fight or flight hormones go up and her labour gets turned off, and it can even deprive the baby of blood and oxygen. So when we put women in this foreign and unphysiological situation, it's no surprise that many women need intervention because labour slows down and because their baby is deprived of blood and oxygen. And that's just a hormonal effect. It's the fight or flight hormones kicking in, as they should do for all mammalian mothers.
Right. So say I saw your example in your book where you have the cat, and you're showing how the cat labours in the cupboard, and when you disturb it obviously slows labour down and things like that. So what you're saying is, say, your partner drives you, speeds you to the hospital in the car, and you're going over every bump, and then you put on it, a birthing bed, and you've got fluoro lights on, and you're saying that pretty much slows birth and changes, doesn't optimize the right hormones.
Well, most women find that when they go into hospital, it's all been going well at home, and you move into hospital, and suddenly things slow down or even stop, and it takes you a while to settle in and again feel comfortable, feel like it's really operating at the primal level. The things I'm talking about, it's our primal systems. It's the middle layer of our brain called the limbic system. So it's not a conscious thing. You can't talk yourself into feeling safe somewhere. And one way to look at it, it's a bit like the conditions that we need for having a baby are very similar to the conditions we need for making a baby. So it's almost exactly the same hormonal orchestration. And you could imagine that same scenario. You're trying to make a baby, and then you get shipped off to hospital, and you're in this strange room, and nothing's really going to happen, is it? So you really settle down and feel private and safe again, and then the whole thing can flow. And it's exactly the same situation for having a baby. And that's quite a good rule of thumb, really. If you want the ideal conditions for labour and birth, you think about the ideal conditions for making a baby. And bright lights and strangers coming in and out through an unlocked door is not ideal. And at the very minimum, if you're going to hospital, you need someone to protect your space.
Right, so that was going to be my next question, is how do you then have an ecstatic birth and conditions that are optimum? Say if you're, I can understand how you can do it at home, but obviously a lot of people are not comfortable at home. This day and age, many of the people that are on our website and our Facebook page are going to a hospital. How do we have that ecstatic birth at a hospital?
Well, there's a couple of things to say. The whole hormonal system, there's a whole lot of what we call positive feedback loops. The hormones just get building on themselves, and that happens as labour progresses. As you go into labour, you sort of get deeper into it, you could say. And it's the early stages of labour where you're most likely to get disrupted by your environment. So one thing is to stay at home until you're really in established labour, and that can take a little while if you're a first-time mum. And I would really recommend, generally, if you're going to hospital, that you have a supportive birth companion with you, also called a doula. And a doula is someone that generally you engage and you pay, someone who's experienced in this area, who's used to being in hospitals and working in hospitals, who can support you and also support your partner. I don't think it's enough to just take your husband in there personally. I wouldn't do that. If I was going to hospital, I'd definitely have a doula, support myself and my husband, and to create that safe space. They really know how to do that in the hospital setting. So have a doula, have her come and support you at home, and then go to hospital with her, and she can really give you some good advice. And of course, the other option, and I think at the moment the only way to have your own midwife is to have your baby at home, but increasingly there's models of care where you can have your own midwife who can come to you in labour at home and then accompany you and care for you in hospital. And I think in the next few years we'll see that more and more available, and that's really the by far the best model of care possible for women, because you have that person. And I remember myself with my first baby, I went into labour at 36 weeks and I was at home and I was a little, oh my God, I'm a bit scared, this is a bit surprising, and I remember when my midwife walked in the door and just seeing her, I just totally relaxed. I thought, wow, I feel really safe with this woman. I know her through all the times we've had together in my pregnancy. She knows me, I know her, and there was something that relaxed in me that allowed me to give birth to my baby about 20 minutes later.
Wow.
So, having someone to help to protect your space is really important, and if you're going to hospital, it's even more important. So I'd really recommend having a doula, at least having someone that's comfortable with the whole birth scenario and comfortable with working in hospitals. And I'd also recommend going to hospital later, when labour is really established and the hormonal physiology is really flowing. It's much less interferable, you could say, by your environment at that stage.
Right.
I could even say that sometimes towards the very end of labour and birth, getting a little bit of fear or anxiety or feeling a little bit unsafe can actually trigger labour. It's a reflex for mammals birthing in the wild. When you're close to the time of birth, sometimes it can actually promote labour. So that's that story where you go into a hospital at the last minute and you have your baby like 20 minutes later, because the sort of unfamiliarity can even trigger labour. And so going into hospital later, I'd recommend that. And I can understand that might be a bit tricky. So have your own birth companion with you, have your own doula to come to your home and accompany you.
What about, a lot of people will obviously have an obstetrician, depending on what country they're in. It seems that Australia and the US, especially the UK, I don't think as much, but they all hire those obstetricians. And I often ask, I was talking to my cousin on the weekend, and I said, "Oh, so why did you hire an obstetrician? Was there something wrong? Were you guys high risk or something?" And they said, "Oh no, well it was just we wanted the best care, and it really wasn't going to cost us that much with our insurance and all that sort of stuff." So, are they not an extra companion at birth that would be beneficial, or how does that affect labour, I guess?
That's a great question. And I think that, instinctively we do know that we need that continuity of care. We know that we need someone familiar in labour, and the only way that's available to us in the current system, apart from hiring a doula, is to have your own obstetrician. Yeah. But the truth is, well, first of all, you're not really going to see much of them in labour. They'll probably only just come at the end. The second thing is, you've got to consider that obstetricians aren't trained in normal birth. They're not the experts in normal birth. That's a midwife. So obstetricians are trained in high-risk birth, and they see a lot of high-risk things. They see a lot of things go wrong, and that's exactly as it should be. They're specialists in the area. So it's sometimes a little hard for them to facilitate or even understand natural birth. I don't really see very many of them. An obstetrician could go through years of training and not actually see a woman have totally natural birth. So if you're wanting a natural birth, it's like going to McDonald's and asking for a porterhouse steak. You're just not going to the right place if you want a natural birth. Marsden Wagner, who used to work for the World Health Organization, he's a perinatologist, a highly trained obstetrician, and he said, having an obstetrician attend a healthy woman in labour and birth is like having a paediatrician come and babysit your healthy 2-year-old. It's just not necessary. It's an overuse of technology. And the other way that I talk about it, because my background is as a GP, when people come to see me as a GP, they come in to see me for primary care, and I'm the expert in that, and they've got a headache, and I can say, well, we do this test, and you might need this or you might need that. But if they went straight to a neurosurgeon with a headache, and then the neurosurgeon would do a lot more fancy things, because they see people with serious conditions with headaches, and it's exactly the same thing in pregnancy. A pregnant woman really needs someone to give them primary care, which again is really the specialty function of a midwife. And at the moment we don't have a lot of availability of your midwife in hospital. In the hospital system, some hospitals do have some schemes where you can have your own midwife. The hospital will give you your own midwife. And birth centres in particular, I really recommend a much better model of care than getting your own obstetrician, and you're much more likely to have a good outcome. If you look at the risks in private hospitals, your risk of all the interventions are significantly higher. So just looking at the figures, you'd say that the best choice for a natural birth is to hire your own midwife, hire your own doula, and not actually go down the private hospital route.